With Wimbledon on the way and the finals today, I decided to cover Serena Williams, the most accomplished female tennis player of all time, winning 23 singles Grand Slams at the making of this video and 4 Olympic gold medals. Late 2016, early 2017, Serena Williams, the former number 1 seed, had to take a break from tennis due to becoming pregnant and giving birth to her child in September 2017. In this video, we're going to look into what changes occurred to her body during pregnancy. Before we start, I'd like to say thank you for 100 subscribers, that means a lot to me. If you like the content, subscribe, and as always, comment down below what other players you would like us to cover in the future. The first aspect of Serena we're going to look into is her breathing, otherwise known as the respiratory system. The first change is caused by the physical presence of the baby in the womb. During pregnancy, as the baby grows, it takes up more space in the woman's abdomen, resulting in the ribs rising upwards and the costal margin rising as well. This reduces the lung capacity and the maximum amount of air Serena could store in her lungs. Regarding normal breathing, to many surprise, women who are pregnant tend to have deeper breathing, resulting in a 30% rise in the tidal volume. The tidal volume is the volume of air breathed in and out at rest. This is caused by the hormone progesterone, which also has other primary functions such as maintaining the lining of the uterus during fertility. On the other hand, the volume of air left in the lungs decreases, resulting in pregnant women often feeling shortness of breath. As you can imagine, this would alter Serena's performance, resulting in her taking a temporary break from tennis whilst pregnant. However, once again illustrating her greatness, she was able to win the Australian Open despite being 8 weeks pregnant. The next change occurs to the blood and cardiovascular system in pregnant women. To accommodate the greater demand for oxygen to the woman but also the fetus, there is a 20 to 30% increase in the number of red blood cells. Also, there's an increase in the volume of blood from on average 2,600 milliliters to 3,850 milliliters. This dramatic increase results in a greater risk of anemia developing due to the dilution of hematocrit, which is a content in the blood. As a result, all women are recommended to take 400 mg of folate B12 tablets to offset this risk. Furthermore, due to the greater volume of blood and greater demand for O2, the cardiac output and heart rate increases, resulting in a greater volume of blood being pumped around the body. Despite the increase in volume, however, there is a drop in blood pressure to around 110/60 due to wide-scale vasodilation, which is the widening of a woman's blood vessels. If you are interested or worried about your blood pressure, I made a couple videos in the past on the science behind blood pressure and how best to manage it. Another notable change occurs to the urinary system of a woman whilst pregnant. There's an anatomical increase in the size of the kidneys by 3% and additionally a 30% increase in the volume capacity. Also, this is once again due to the hormone progesterone, which results in an increase in the frequency of urination, with more water passing through as urine and not being filtered out. This causes the woman's urine to become more dilute and less concentrated, producing a clear, pale-coloured urine. Pregnant women often suffer from something called hydronephrosis, meaning it is often a feeling of not fully emptying their bladder. This increases the feeling that a pregnant woman needs to go to the toilet a lot. With the Wimbledon finals underway, we hope Serena can continue her reign of dominance and win this year once again. Before we finish, subscribe if you like the content and comment down below who you would like me to cover next. Also, share the content with your friends, and once again, thank you for watching.